Before you start taking budesonide, make sure to read the Patient Information Leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily in the morning. Swallow the tablet whole with a full glass of water unless your doctor tells you otherwise. Do not crush or chew the tablets. The dosage and length of treatment will depend on your medical condition and how you respond to the treatment. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe to do so. If you are regularly taking a different corticosteroid by mouth, such as prednisone, do not stop taking it unless directed by your doctor. Your doctor may slowly lower the dose of your old medication after you begin taking budesonide to prevent withdrawal symptoms. Use this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when this drug is suddenly stopped. Let your doctor know if your condition does not get better or if it gets worse. This medication, Budesonide DRR 9 mg tablet, works in the gut and only small amounts are absorbed into the body, which usually results in fewer side effects than other corticosteroids. Some common side effects may include nausea, abdominal pain, or headache. If any of these effects last or get worse, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. While many people using this medication do not have serious side effects, it's important to be aware of the potential risks. Because this drug works by weakening the immune system, it may lower your ability to fight infections, making you more likely to get a serious infection or make any existing infection worse. If you have any signs of infection, such as a sore throat that doesn't go away, fever, chills, or a cough, tell your doctor right away. This medication may also sometimes cause oral thrush or a new yeast infection. Contact your doctor if you notice any new symptoms. Be sure to tell your doctor right away if you experience any serious side effects, including easy bruising or bleeding, puffy face, unusual weight gain, changes in menstrual periods, mood changes, muscle or bone pain, thinning skin, slow wound healing, increased thirst or urination, vision problems, or symptoms of stomach or intestinal bleeding. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of an allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, be sure to contact your doctor or pharmacist for further advice. Before taking Budesonide DRR 9 mg tablet, it's important to talk to your doctor if you have any allergies or if you have a medical history of certain conditions. Using this medication for a long time can make it harder for your body to respond to physical stress, so it's important to let your doctor know if you have surgery or emergency treatment, or if you get a serious illness or injury. You should also be cautious about using alcohol while taking this medicine, as it may increase your risk for stomach bleeding. Additionally, this medication can make you more likely to get infections or may make current infections worse, so it's important to stay away from anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or the flu. You should also tell your healthcare professional before getting any immunizations or vaccinations, and avoid contact with people who have recently received live vaccines. For older adults, they may be more sensitive to the side effects of this drug, especially bone loss/pain, stomach/intestinal bleeding, and mental/mood changes. For children using this medication for a long time, it may slow down their growth, so it's important to consult with the doctor for more details and to have regular checkups. During pregnancy, this medication should only be used when clearly needed, and the risks and benefits should be discussed with the doctor. If you are breastfeeding, it's important to consult with your doctor before continuing to breastfeed while using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Budesonide DRR 9 mg tablet delayed and extended release glucocorticosteroids are aldoslucin, mifepristone, and drugs that can cause bleeding/bruising, including antiplatelet drugs such as clopidogrel, blood thinners such as dabigatran/warfarin, NSAIDs such as aspirin/celecoxib/ibuprofen. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, usually 81 to 162 mg a day, you should continue taking it unless your doctor instructs you otherwise. It's important to ask your doctor or pharmacist for more details. It's also important to note that this product may interfere with certain lab tests, such as skin tests, possibly causing false test results. Make sure that lab personnel and all your doctors are aware that you use this drug. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is important not to share this medication with others. If you are using this medication for a long period of time, your doctor may recommend certain lab and/or medical tests such as blood count, bone density, eye exams, and height/weight measurements. It is important to keep all medical and lab appointments. Consult your doctor for more details. Using this medication for a long time may increase the risk of bone loss, osteoporosis. To promote healthy bones, it is recommended to increase weight-bearing exercise, stop smoking, limit alcohol intake, and eat well-balanced meals containing adequate calcium and vitamin D. If you happen to forget to take a dose of Budesonide DRR 9 mg tablet, take it as soon as you remember. However, if it is almost time for your next dose, it's best to just skip the missed dose and take the next one at your regular scheduled time. It's important not to take a double dose to make up for the missed one. When it comes to storing Budesonide DRR 9 mg tablet, make sure to keep it at room temperature, away from light and moisture. It's important not to store it in the bathroom and always keep medications out of reach of children and pets. When it comes to getting rid of expired or unneeded Budesonide DRR 9 mg tablet, make sure to dispose of it properly. Don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.